COVID cases plummet, no more jab mandates for care workers, and there's a nasty seasonal virus on the rise. Daily COVID cases in the UK are in freefall, with numbers now 50% lower than a month ago. New cases of coronavirus recorded in the last 24 hours on March the 2nd were at 44,017. That's compared to 92,592 on February the 2nd. However, it's worth noting that the government's decision to lift testing requirements in England means our ability to detect cases has been curtailed. The huge drop in cases has also been accompanied by a big fall in deaths. Every death from COVID is a tragedy, and thankfully the numbers of people succumbing to the illness has plummeted, from 552 a month ago to 74. Although the virus is still spreading through the population, it is far less lethal than it once was. Omicron is a milder strain, especially for the vaccinated, although for some it can still be very serious if caught, so Brits are still being encouraged to avoid spreading it. As the pandemic continues to slow, the government has made a big U-turn on their decision to require vaccination for care home workers. From the 15th of March, laws requiring that all care home staff be double jabbed will be revoked. Under previous plans, thousands of workers would have been forced out of work if they refused to have the jab. Brits are now learning to live with the virus, with government policy pivoting to encouragement rather than enforcement for vaccine uptake. But despite dropping the legal requirement, Health Secretary Sajid Javid called on unvaccinated healthcare workers to still get jabbed, saying, "I have made it clear that I consider it a professional responsibility for health and care staff and others who work in the health and social care sectors to be vaccinated." However, there is confusion about what will happen to those already dismissed from their jobs due to the previous legal requirements. It's estimated around 40,000 workers have already lost their jobs due to the measures, which came into effect in November, with April initially bookmarked as the cut-off date. A senior government source told The Sun that Omicron has changed things. For Omicron, while it is more transmissible, all the studies have shown it is less severe. That has changed the conversation about whether mandatory jabs are still proportionate. But as the spectre of COVID recedes into the distance, another nasty bug is on the rise in the UK: Norovirus. Health chiefs have issued a warning to Brits as outbreaks of the seasonal stomach bug have increased. The virus, usually most prevalent in winter, has begun to spread through care homes in England, which can be dangerous for vulnerable residents. Outbreaks of norovirus have been limited since the start of the pandemic due to mixing between people kept to a minimum during both winters. But now, as the UK returns to normal, other germs will start to creep back into daily life. Norovirus causes nausea, projectile vomiting, diarrhea, and can also cause fever, stomach pain, and aching limbs. It can spread quickly through contact with infected patients or contaminated surfaces. To avoid spreading the virus, wash your hands with soap and water, because hand sanitizer does not work on norovirus. If you think you've been infected, try to avoid going to the GP in person, but if you're concerned, organise a phone appointment instead.